So we're looking at the respiratory distress syndrome. But if you notice, anytime somebody's talking about a respiratory distress syndrome, they always refer to, like, infant, people that they just gave birth to them and all of that. So just so you know that it could actually occur in the adult too. It could occur in the adult too. So this is when it occurs in the adults. This is what is known as adult respiratory distress syndrome. Okay, so this one just have to do with your air sacs. They are not empty for air to occupy again. You have fluid filling your air sacs, so the fluid is basically filling up where air is supposed to be. Okay, so acute, this is the adult one. All right, so it's a life-threatening condition. This is where the lungs become severely inflamed, filled with fluid, so it makes it very difficult for you to be able to breathe, because what, the fluid is filling up where oxygen is supposed to have been filled. Right, so it's a form of acute respiratory failure, often occurs in people who are critically ill. So what are the possible causes? It could be sepsis, like a body-wide infection spread, severe pneumonia, COVID-19, trauma, that's all those chest injury, head injury, aspiration of gastric contents, inhalation of toxic fumes or smoke, pancreatitis, or massive blood transfusions. The pathophysiology is quite simple. There's a damage, there's accumulation of fluid. So there's damage to the alveolar capillary membrane. So this leads to like leakage of fluid into the alveoli. So this results in a non-cardiogenic pulmonary edema, reduced lung compliance, and severe hypoxemia. All right. So these lungs become stiff. The gas exchange is basically still impaired. All right. So this is kind of like diagnostic criteria where you get to know if the condition is mild, if it's moderate, or if it is severe. This is a Berlin definition. So you can pause to actually look at it. So you should note that symptoms must occur within 1 week of a known insult and must be fully explained by cardiac failure or fluid overload. Right. So symptoms, you have those rapid labored breathing, severe shortness of breath, cyanosis, they have like a bluish skin, confusion of fatigue, low blood oxygen levels despite oxygen therapy. So these are the possible treatment. Of course, the primary problem that the person is having is the person is basically, how will I put it, you're having problems with breathing. Then it's a prone position to improve the oxygenation, sedation, treating any underlying cause. In severe cases, extracorporeal membrane oxygenation may be used. Complications could lead to pulmonary fibrosis, ventilator-associated pneumonia, barotrauma, multi-organ failure, and long-term cognitive and physical impairment. So that was it for the adult respiratory distress syndrome.